In this video, we're going to talk about 3 supplements that are commonly used to help treat sexual side effects from antidepressants. And make sure to stick around to the end because I'm going to fill you in on the one that is my personal favorite. The first supplement that you need to know about is S-adenosylmethionine, or SAMe for short. So what is SAMe? It's a naturally occurring substance that is found in almost every cell of your body. It has many different functions, and some of the areas that it helps with most include sustaining a healthy immune system, maintaining cell membranes, and producing and breaking down neurotransmitters in your brain. And we're talking about the big players here, so serotonin, dopamine, and norepinephrine. So how does SAMe help? The journal European Psychiatry published a randomized controlled trial that looked at whether or not SAMe was helpful in improving sexual functioning in men who are on antidepressants. And what they found was that those who were treated with SAMe had improvements in both sexual arousal and erectile dysfunction. Now, how is SAMe dosed? Evidence supports taking between 400 milligrams twice a day to 400 milligrams 3 times per day. And if you're wondering which brands are most reputable, make sure to check out the links below because I included products that have been tested by consumer labs and have passed their quality certification program. Supplement number 2 that you need to know about is saffron, and this is a spice that is derived from the flower Crocus sativus. And there have been a couple of randomized controlled trials conducted in both men and women, so let's start with the ladies first. In 2013, the journal Human Psychopharmacology came out with a study that looked at 34 women with major depression who were stabilized on fluoxetine or Prozac that had reported sexual dysfunction. They were randomly assigned to either a saffron group or a placebo group for 4 weeks. What this study found was that those in the saffron group experienced significantly more improvement in sexual functioning, particularly when it came to the areas of arousal, lubrication, and pain. Now for the men, the journal Psychopharmacology Berlin published a randomized controlled trial in 2012 that was very similar to the one with the ladies. When evaluating 30 men with major depressive disorder who were on fluoxetine, they found that those in the saffron group had significant improvements in both erectile function and with intercourse satisfaction. Okay, so how do we dose saffron? Both of these studies had their participants take 15 milligrams twice a day, so this is generally what's recommended. Now, if you're looking for a way to keep track of all this information, make sure to download my free PDF because I already have all this information neatly organized for you. The third supplement, and one of my personal favorites, is MACA, and this is because it's one of the top studied, most effective, and safest supplements. So what is MACA? It's a starchy root vegetable that has been shown to have a wide range of uses. It can improve mood, boost your immune system, increase stamina and energy, and improve sexual functioning. And many people claim that it's due to its testosterone-like effects. So what's the evidence for this supplement? One of the top studies conducted was one by researchers in the psychiatry department at Mass General Hospital. They did a randomized controlled trial on 20 outpatients, mostly women, who had sexual side effects from their SSRI. They were given either 1,500 or 3,000 milligrams of MACA per day, and what they found was that the higher dose group had a significant improvement in sexual functioning. Now, there are 2 more randomized controlled trials worth mentioning here. The first looked at men with erectile dysfunction, and this study found that MACA helped with their perception of sexual well-being. The second study looked at women who were on either an SSRI or an SNRI, and they found that MACA root was helpful in alleviating sexual side effects, especially in the women who were postmenopausal. When it comes to dosing MACA, 2,000 to 3,000 milligrams per day is what's recommended. Also, when you're shopping for this, you might notice red, black, or yellow MACA options. What you need to know is that there hasn't been a notable difference between the 3 types when it comes to improving libido, but the red and black forms are the ones that have been the most well studied. If you're gonna get this supplement, I strongly encourage you to get one that's approved by consumer labs because recently they tested a product that was found to be contaminated with lead. And remember, no medication, even over-the-counter medications or supplements, come without risk. So make sure to talk to your doctor before starting any of these options. Now, if you're wondering about the medication strategies that doctors use in clinic to treat antidepressant-induced sexual dysfunction, make sure to click that top video.